Welcome to our video. Today we talk about ringworm treatments. Ringworm treatments. When you have a case of ringworm, you may want to try using one of the many ringworm treatments available. These include Grifulvin V, Onmel, Fluconazole, and Sporanox. If none of these seem to be working, try a combination of them. There are also natural remedies you can use. Tea tree oil can be applied to the affected area 3 to 4 times daily and has antifungal and antiseptic properties. However, tea tree oil can irritate sensitive skin. Aloe vera contains antifungal and anti-inflammatory properties. Grifulvin V. Grifulvin V is an antifungal drug that has been available for decades. Although not effective against yeast, it can effectively treat tinea capitis. Grifulvin is often used in the first-line treatment of the disease and is also used to treat more widespread, more severe infections of the skin, including tinea manuum, unguium, and corporis. It is also generally well tolerated in children. One of the major concerns about Grifulvin is that it can cause an allergic reaction. The symptoms of an allergic reaction include hives, itching, burning eyes, and a red or purple rash. You may also experience a fever or blistering rash. If you have any of these symptoms, contact your doctor immediately. The best way to determine whether you are allergic to Grifulvin is to undergo a blood test. If you aren't sure whether or not Grifulvin V is right for you, consult your doctor or pharmacist. The antifungal agent belongs to the group of drugs known as antifungals, systemic. It is not safe for children under 2 years of age and can lead to unpleasant side effects. Grifulvin V is not recommended for use in children under 2 years old, as it may have serious adverse effects and should only be used as directed. Grifulvin V is not recommended for pregnant or breastfeeding women. It can weaken the effectiveness of birth control pills. Also, it should not be used in children younger than 2 years of age. Grifulvin V is a Category X drug. Pregnancy should not be undertaken if you have any of these medical conditions. This medication may increase your risk of pregnancy and should be discussed with your doctor before taking it. Onmel. Onmel ringworm treatment involves taking antifungal medication. Antifungal medication is the only cure recommended by the American Academy of Dermatology. A cool compress is another effective remedy for ringworm. It should be applied to the infected area for at least 20 minutes each day. Ringworm thrives on moisture and warmth. To avoid the spread of ringworm, it's important to keep the infected area clean and dry. Avoid wearing clothing that absorbs sweat and change your clothes every day. Before using Onmel, it's important to follow the directions carefully. If you experience any side effects, call your doctor immediately. This treatment may cause liver damage. If you experience any of these symptoms, you should stop using Onmel immediately. Onmel should also be stored at room temperature, away from moisture and light. You should also keep the medication out of the reach of children. Onmel should not be used by pregnant women or those who are lactating. Onmel is an antifungal medication used to treat fungus infections in adults. It can be used for fungal infections of the fingers and toenails, but some brands are not meant for this use. It should not be used by people with heart failure or who are taking drugs that cause gastrointestinal upset or congestive heart failure. The medication should not be used by pregnant women with heart problems. It should also be avoided by people taking colchicine, sulfenacin, or fesoterodine. Despite its effectiveness, Onmel has several side effects. It may interact with some medications, such as stomach acid reducers. In addition, you should follow the full course of treatment and not skip a dose. It is important to note that Onmel will not treat viral infections, and you will need to go to the doctor frequently for monitoring. Onmel should be stored at room temperature, out of sunlight and heat. When taking Onmel, it should be taken with non-diet cola. It is best not to take 2 doses at once, as you may end up with a resistant infection. Sporanox. Sporanox ringworm treatment contains a drug called Fluconazole, a triazole that prevents fungi from building cell walls. This drug is available in capsule form, and in a liquid 10 mg per milliliter preparation. It is not recommended for children under the age of 6. People with certain conditions, such as heart failure, liver or kidney disease, should not use this drug. Also, people should avoid taking it with certain drugs, such as colchicine, fesoterodine or sulfenacin. Itraconazole may harm an unborn child. It should be avoided by pregnant women and breastfeeding mothers for at least 2 months following the last dose. A limited number of clinical trials have been performed with Sporanox. The capsules must be taken with a meal in order to be absorbed properly and effectively. In addition, patients with systemic fungal infections such as AIDS and cystic fibrosis should not take the drug. However, it is safe for people with a compromised immune system. Besides, Sporanox has many other benefits. People with heart failure should avoid using Sporanox ringworm treatment. The drug can increase the risk of congestive heart failure, which is a life-threatening condition. Patients with heart failure or history of heart disease should consult with their healthcare providers before starting it. They should also tell their doctors if the condition worsens. It is also recommended to consult with your health professional before using Sporanox ringworm treatment. A non-prescription medication called Sporanox can also be used for ringworm. This cream should be applied over the rash. It may also be used on the nails for fungal infections. But, it should be used according to the instructions on the package. It should not be used by pregnant women, elderly people, or people with liver diseases. For best results, Sporanox ringworm treatment should be used in combination with a prescription antifungal medication. Fluconazole. Fluconazole is a prescription medication used for treating fungal infections. However, it is important to follow your doctor's instructions and not stop taking the medication early. Stopping the drug too soon increases your risk of infection recurrence and the fungi may become resistant to the treatment. Some people should not take fluconazole for ringworm treatment because they have liver or kidney problems, or have a rare blood disorder called porphyrias. Additionally, it can cause an abnormal heart rhythm, prolonged QT interval, and electrolyte disturbances. In most cases, fluconazole should be taken once a day, usually in the morning. It should be taken at the same time each day. However, if you have kidney or liver disease, your dosage may need to be reduced. Also, you should consult a doctor if your condition worsens or persists. Fortunately, fluconazole is relatively easy to take. And once you've found the right dosage, it's easy to see results. Besides ringworm, fluconazole is also used to treat a variety of fungal infections, from vaginal yeast infections to meningitis. It is also used in some people to prevent fungal infections, such as those with HIV, cancer, or organ transplant operations. Your doctor should explain the risks and benefits of fluconazole before you start taking it. You should also know the side effects and dosage of fluconazole before you start treatment. If fluconazole is not effective for you, there are alternative treatments. You may also consider using antifungal nail paint or topical cream that contains fluconazole. But make sure to follow the instructions for fluconazole for ringworm treatment. If you're worried about the side effects, try terbinafine or fluconazole for ringworm treatment instead. You might find it difficult to remove the infection without medication. Tea tree oil. If you are worried that you may have ringworm and are wondering how to treat it, tea tree oil for ringworm treatment may be just what you need. While it is considered to be safe and effective, tea tree oil may cause some irritation on your skin. You should dilute tea tree oil before applying it to your skin, and apply it to the ringworm lesion several times daily. You may also find it helpful to add a few drops of tea tree oil to your bath water if you have many lesions. Always speak to a medical professional before using tea tree oil, however. When using tea tree oil for ringworm treatment, you should first dilute the oil with a carrier oil, such as coconut oil. You can also apply the mixture to the lesions, using a cotton swab or Q-tip. You should apply the mixture 2 to 3 times per day to minimize the chances of skin irritation. You should do a patch test to ensure that tea tree oil is not causing any irritation. However, if you notice any new redness or itching, you should discontinue the treatment. If you have any doubts about the effectiveness of tea tree oil for ringworm treatment, you should visit a dermatologist for advice. Research conducted by Carson C. F. and Riley evaluating tea tree oil for ringworm treatment showed that this product has antifungal and antifungal properties. They concluded that despite the adverse reactions, tea tree oil for ringworm treatment is safe and effective for most patients. But be cautious, tea tree oil is not recommended for pregnant women as it is toxic to newborns. If you have a high risk of ringworm, make sure you consult a medical professional before using tea tree oil for ringworm treatment. Thank you for watching. Please like, comment, and subscribe if this was helpful.